Hello A&P students, my name is Eric Barn, and today I'm going to be going over some clinical cases having to do with your cranial nerves to try and help you guys remember them. So let's dive into this. So if we start with this first clinical case here, it says, suppose one of your patients has come to your clinic and they are diagnosed with a fracture of the sphenoid bone at the level of the superior orbital fissure. Now, which of these cranial nerves will be at risk of damage, and what functions may be affected as a result of this? So let's go over to visible body to explore this a little further. So before we go any further, I would just like to point out exactly the area we're going to be dealing with. So here we have an anterior view of the sphenoid bone, and the superior orbital fissure will be located here and here. So there are two of them, and then if we look posteriorly, we can also identify them both here and here. So if we exit this, we can now see that this right here and this right here is going to be the area that's being affected. And we can also see a few cranial nerves that are going to be running through this fissure. So if we zoom in here a little bit and start highlighting some of these nerves, we have three nerves here that are going to be going through this superior orbital fissure. We have the trochlear, oculomotor, and ophthalmic branch of the trigeminal nerve. So in terms of testing these, because we have a fracture at this level, we're gonna want to test these nerves to make sure they're still functioning correctly. So if we start with the trochlear nerve, so the trochlear nerve innervates one of your eye muscles that will rotate your eye inferiorly and laterally. So if we want to test this muscle, we can check the patient's ability to move their eye inferior and lateral. And if they're unable to do that, we might think there's some damage to this nerve. Then the next one we might identify as injured, we could say that the oculomotor may be damaged here. And the oculomotor nerve will also be innervating many of your eye muscles. So we can test, again, eye movement. And then if our patient is unable to move their eye effectively, then we may suspect some damage to this oculomotor nerve here. And then finally, we have our ophthalmic branch of this trigeminal nerve. So if we zoom out a little bit here, we can see the trigeminal nerve easier right here. And it's going to be the bigger cranial nerve that gives off three branches. And we're focused here on the ophthalmic branch. So if we follow that through the superior orbital fissure, this nerve will be providing sensory information to the upper face and scalp. So to test this, we can simply touch the patient's either forehead or scalp, and then if they're unable to feel that, then we may suspect some damage to this nerve. So let's go back and do another case study now that we know the answer to this. So here is our next case study. So suppose you have another patient that comes into your clinic complaining of trouble hearing and balancing. Now this patient also mentions that they had trauma to their temporal bone recently. So what cranial nerves can we test for damage, and what foramen are they going to be going through? So again, let's take this over to visible body so we can visualize this a little bit easier. So now that we're in visible body, we can see that we are looking from a lateral view, and the first thing we need to do is identify that temporal bone, which will be this guy right here. And there it is highlighted. Okay, so now if we look on the inside of the skull, we can see that there's this hole right here with two cranial nerves running through it that are part of the temporal bone. And this hole right here, I'll give you guys a second to try and guess which one it is. Okay, so this will be our internal acoustic meatus, and it will have two cranial nerves running through it. It will have your facial nerve as well as your vestibulocochlear nerve. So if we remember back to our case study, our patient was complaining of a loss of balance and hearing, which is what the vestibulocochlear nerve will do. And we can test this by either whispering something in their ear, and if they can't hear it, then we may suspect this nerve, but we can also do a balance test to test this nerve. So if their balance is off or they can't balance effectively, we may also expect this nerve. And then the other nerve going through here is the facial nerve. Now this nerve is going to be providing motor innervation to your facial muscles. So we can test if those facial muscles are working correctly, and if they aren't, we can again suspect this facial nerve. So just to summarize this now, we're going to have our internal acoustic meatus here with our two cranial nerves, our vestibulocochlear and our facial nerve running through there. Now that is all I wanted to go over with you guys, so thank you for your time and have a great rest of your week.